Hello everyone, my name is Aakash and I welcome you all to yet another episode of Bricks of the Wall. Friends, before I introduce you all with our guest, I would like to tell you all that this is a must-watch episode as it helps us to understand that how health and hygiene are correlated and will also elaborate the fact that with simple steps how we can cure deadly diseases. Friends, while shooting this episode, I had an honor to interact with the senior scientist at International Center for Genetics, Biotechnology and Engineering, Dr. Navin Khanna, who is globally recognized as the creator of Dengue Kit 1, the device which detects the disease dengue and its symptoms in 15 minutes. Friends, in this episode of Bricks of the Wall, we have touched upon the various aspects of dengue disease, how as citizens we can play a vital role in eradicating this disease from the country, how COVID was the blessing in disguise for biotechnology, the importance of research and development work, and the importance and significance of great leadership in our country. Friends, as a host of Bricks of the Wall, I would request you all to watch the full episode and share it with your friends, as I really want that messages of Dr. Navin Khanna should reach to maximum people and would request you all to implement it in your daily life. Now, I leave you all with the episode and hope you guys will learn a lot and will enjoy the interactive session between me and Dr. Navin Khanna. Thank you. So, good morning, Dr. Navin Khanna, and welcome to Bricks of the Wall. So, sir, before we dive into the subject of your own research and history and your invention of Dengue Kit 1, I would like to know from you, like there are so many cases rising up from Uttar Pradesh of dengue. Yesterday only I was reading that there are more than 7,000 cases have been reported now. And you must be closely observing these cases and what is the status of this disease right now in Uttar Pradesh and how administration and government is responding to that. So what is your observation, sir, that why is this like so many cases are rising up, and even in children we are seeing that children are suffering from these cases? So what is your take on this, sir?
Yeah, this is sad, truly sad that one can control dengue very easily by just controlling the mosquito population. And I think the mindset of the people have to change. We want everything to be solved by the government. You can't expect government to come and clean the stagnant water around your house. Dengue mosquito is very different than malaria mosquito. The malaria mosquito flight range could be several kilometers, while the dengue mosquito flight range is about maximum 200 meters. So what does it say? That if you keep your surroundings 200 meters around you, whether you work in office or you are at home, just free from open fresh water, not too much to ask, and you are free from dengue. So the government is reminding all the time, including Delhi government and government of India, but I think the citizens have to take that responsibility, especially post rainy season. If you see collected water here and there, just fill it up with some mud, or you just throw something over this. Just make sure that there is no clean water. Now, as I said, that the malaria mosquito loves dirty water. So, you can't be cleaning so much dirty water, but stagnant water. This one is fresh water and stagnant water. So post rainy season, for example, dengue is always reported by the media like if this is the worst dengue this year. But if you look at historically, it depends on the rain of that season. If there is too much rain in that particular season, you have more dengue. And some states like Karnataka, Gujarat and UP, Bihar, Delhi, if you go back into the data, which is available on the Government of India website, you will find that it's always the case. So there is nothing new about this, but the media has to project everything in a new manner, then only people kind of pay attention to it. Karnataka had tens of thousands of cases for several past years. So did Gujarat, and so did UP, so did Bihar, so did West Bengal, so did Tamil Nadu, so did Kerala. So I don't find this very different than any other year. Yes, compared to last year, this could be a little more. But as I said, it depends on the rain. If you had more rain, plus last year there were restrictions. People were mostly were at home, and there was a lot of sprays which was being sprayed. This to get rid of the COVID virus, the antiviral sprays, which also kills any other mosquitoes. So in brief, there is nothing new. This is the same story every time, and the children are the most sufferers every time. And we keep saying, you may hear that, oh, this is a different genotype of a different serotype. In last 50 years, most of the epidemics of dengue has happened either from dengue 1 or 2 or 3. Dengue 4 has never caused this much of a problem. So this time it's dengue 2. Then they say, no, there is a small variant of dengue 2. I don't believe that. All dengue 2, all dengue 1, all dengue 3 are capable of causing a severe disease. Early diagnosis is important. Early diagnosis can save lives. The fear of dengue is that you can lose a patient in few hours. So from dengue fever to dengue hemorrhagic fever to dengue shock syndrome, this is why it creates panic. This is in our hands. For example, for COVID, we all use these masks. For dengue, when the rainy season comes, just make sure there is no water, fresh water, open fresh water around you. So it's very simple.
Okay. So, doctor, as you mentioned that about the 4 variants of dengue, there are 1, 2, 3, and 4. So, sir, like if you, in a very simple language, if you can explain to our viewers that what is the difference in these 4 variants, and also how it causes, like are there different kind of mosquitoes which causes these different variants, or it causes from a same mosquito but it's a different level of diseases?
So it is the same mosquito, Aedes aegypti, and you can recognize this mosquito is like you can have white stripes on its legs. It's known as a tiger mosquito. It bites in the daytime and not in the night. Very easy to identify. And mosquito can get the virus from its mother. So once the eggs are infected, you have new mosquitoes which are already come pre-infected. So once the mosquito is infected, it's infected for life. It can carry any of the virus, dengue 1, 2, 3, 4. It can even carry chikungunya and dengue. So there could be combination of these viruses in the same. It could carry 2, they are called serotypes of dengue, 1, 2, 3, 4. Serotype means there are 4 distinct viruses, but they are similar. They cause similar disease. And as I said, each one of them is capable of causing a mild, moderate, and severe dengue. That is to say, dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. So these are, as I said, distinct viruses, but they are still related with each other. So I would say, if you loosely say that they're about 50% related to each other, but still distinct. So dengue 4, as I said, always causes a very mild disease. It's not a major problem. So, and dengue is more related to Zika. and dengue and Zika can crosstalk, and the virus can be present in the same mosquito. So the mosquitoes, in fact, if you ask a kid, if you're in a forest, which is the worst animal you are scared of? Many people may say, oh, it's a tiger, but it's a mosquito,
True.
which can carry so much viruses and create hell.
Okay. So, doctor, when in your first answer, you mentioned that it's a mistake from public only. Like it's their negligence which is causing this disease, and with that too with such intensity. So, what do you think? Like, where are we lacking? Are we lacking in education or awareness programs?
It is so simple, as I said, to ensure, and I think those awareness is happening now, and things are changing. And hopefully, as I said, that the media awareness is also very important.
Yeah.
That not only once the rainy season is over, all the awareness disappears. So it's very periodic, it's very seasonal. We need to keep it up. We need to tell people that you clean your homes, just make sure that your areas around your homes are also free from open, fresh water.
So, according to you, it's a matter of taking up accountability from the public itself.
Absolutely.
Okay. What led to the creation of Dengue Kit 1 and its significance in the society right now?
Yes. So, there is a story that our beloved President Abdul Kalam ji,
yes, sir,
had called ICGEB, where I work.
Yes, sir.
And he said that the Indian Army on both the Eastern Front and the Western Front suffers from dengue.
Yeah.
And dengue is a rainy season fever. You could have dengue, chikungunya, malaria, leptospira, typhoid, any of these mixed up also. And symptoms are also pretty overlapping. It becomes very hard for a clinician we have great clinicians, they can tell, but it's always a good idea to have a confirmed test. There were no good tests available for dengue. So he asked us that, could you help us in designing a dengue test? Our director at that time, he was from US. So he did not kind of understand the gravity of the call. He said, which was true, that we don't work on dengue. Yeah. Then another call came that if the president of country wants you to work on dengue, you have to work on dengue. So we said we have no money to work on dengue diagnostics. So immediately the money was provided by the defense labs. And that's how the dengue work began. As I said, that the early diagnosis is important. And in my research lab at ICGEB, we kind of keep asking, how can we make an impact outside the lab? Because we are all funded by the public money.
True.
So we keep asking this question every day, so what? What next? Whenever we do an experiment. Before working on dengue, I have had transferred technologies for diagnosis of HIV, hepatitis C, hepatitis B, celiac, so several diseases for which the diagnostic tests were kind of prototyped in our lab by our PhD students and postdocs. And then they were transferred to a local manufacturer, which is a WHO's certified good quality manufacturer of diagnostic kits. So we had this relationship with this company. What I'm trying to say is the role of the manufacturer is as important as the role of a researcher. Because you could have a good research, unless it is translated and reached to people, it has no value. So we had a prototype, it was a kind of an unvalidated diagnostic test. And we had transferred this know-how to this company. The owner of the company, Mr. Lalit Mahajan, he is a graduate from IIT Chennai, wonderful human being. A true Indian, believes in Make in India mindset. And he had successfully launched the kits for HIV, the HCV, the HPV, and several from our lab. And we were very happy with his kind of a mindset that he takes a small seed from us and turns into a big tree. And many of those kits are of high performance, but at a very affordable cost. How did we meet him? There is another story.
Yes, sir.
That once they had gone to China for a conference on diagnostics. And they kind of got the impression that Chinese diagnostic markets is going to come to India and they can make it so cheap, and these Indian companies will know what hit them. Now they had come to us, Mr. Lalit Mahajan had come to us asking that if we have something for, let's say, for hepatitis B virus detection. We gave him some reagent and he checked within 3 days and he came back, he said, wow, this is great. And he told me that the production cost of that diagnostic kit with our reagent was 6 rupees a test, which is less than a water bottle.
Yes, sir.
No Chinese can compete with that. This is how our relationship worked with him. So affordability of high quality diagnostic kits within our country and to other second and third world countries. So it was almost the same time like we are sitting today. Mr. Mahajan is like that time 65-year-old. He's sitting in a boardroom. He has fever. So his lab people take his sample and then test with our kit, and they come back and they say, sir, you have dengue. Now he is the boss. You don't want to be wrong. And this is an unvalidated kit. That time there were kits available from US, from South Korea, and from Australia. They were the validated kits being sold in the market. They did the test with other 3 kits. It was negative. Now, if it was you or me, we would believe the validated test. The new test, which is still being prototyped, I won't believe it. But this, I salute this gentleman, Mr. Lalit Mahajan, because he believed in our test. He told his team, if ICGEB reagent-based test says I have dengue, I believe I have dengue and I'm going home. Then he did one experiment on himself. He asked Dr. Dang's lab from here, from Hospas. The technician used to go to his home, collect 30 ml of his sample every day for 1 month. Now he had 30 samples. And then he comes to the lab and asks his team to test for dengue biomarkers in his blood by all the 4 tests, the 3 which were validated, the 4th which was ours, which was still being worked upon. Our test scored dengue presence from day 1 of his fever. It was just, he just started to have fever. The other tests came, scored on day 3, some tests scored on day 4. And then apart from the antigen, which comes from the virus, we have antibodies which come from the patient, which is the immune response. So then we look at the antigen, which is coming from the dengue. And then later on, you look for antibodies, which can be 2 types called IgM type and IgG, the early and the late antibodies. So these are 3 markers which you can tell the dengue. So the story was that it was true dengue because the antigen came, then the antibodies came. So he was really surprised. So with that, he said, wow, this test can detect dengue fever from day one of fever. And that's how he coined the name dengue day one test. So if it was not for his trust in this test would not have gone to the market.
True, sir. So
Since then, this test has done very well, but I don't know how much time I have because I can keep talking about this test. There are a lot of stories because even if you have a good test, market acceptance is always a problem.
true, sir.
How did the market acceptance happen? There are a lot of stories about it, but I don't know how much time do we have to talk about it. So you tell me.
Okay. So, sir, as you clearly mentioned the contribution of Mr. Lalit Mahajan, so one thing I want to mention here is that as government is now talking about the indigenization of defense industry, I believe that Mr. Lalit Mahajan had that kind of a spirit even way back from your story.
Absolutely. No, even so he is one of the largest diagnostic manufacturer in India.
Okay.
And he is the largest exporter of diagnostic kits from India. And as I said, he's a true Indian because everything has to be made in India. He does not want to import anything.
Yes.
So, and I think we are like two strands of DNA, we do something, he does something, and together we make things happen.
Cool, sir. So, doctor, like since pandemic, like as last year was really tough for everyone, but it has opened door for the healthcare sector, and it gave an opportunity for doctors and even for researchers to explore more in our country. So, what do you think? Like since pandemic and since COVID era, what has like evolved, and how biotechnology and how science can like in future improve our healthcare sector, which I believe like still needs a lot of improvement and a lot of like research work in our country. So what do you think like about that?
Yes, I think you're absolutely right that India is the world pharmacy, right?
Yes, sir.
And we produce the good quality medicines at the cheapest possible price in the world. We are the vaccine hub of the world. We produce, almost, it seems that almost 50% of the kids born in this world take at least one vaccine made in our country.
Yes.
But the biotechnology, although the contributions were immense, but it wasn't being looked at it as a force. For example, you have an air force, you have an army, you have a navy, wherein you are already prepared. Even in the peacetime, you prepare, you practice for the war times.
Yes, sir.
So I believe now with this COVID, the concept is coming that similar to this defense forces, you should have a bio force,
True.
This force of biologists and engineers and doctors and healthcare workers and other staff members should always be empowered even when the disease is absent. So you are looking for new diseases, you are fighting those new diseases. And I think with our Prime Minister, a lot of those things have happened.
Okay.
A lot of funding has become available. So biology has come at the forefront. The prevention, the vaccine industry has come at the forefront. So I think things are changing now, and there is a lot more public awareness and acceptance. I'm really, really delighted to see how citizens of India are so cooperative, in giving their arm to get that vaccine. And you see in many countries where we call them so developed, despite having so many vaccines, they don't want to even get vaccinated.
Yes, sir.
So I think the government is doing its job incredibly well. People are very cooperative, and even the implementation of masks have been really good. And hopefully the worst is over. But we just have to go through this festive season, and mask is essential. to kind of move away from this problem.
So, doctor, as you mentioned that government is doing a lot of work towards creating a bioforce which will make us ready for the combat in future. I hope that day never comes, but still we'll be ready for that. So, sir, I want you to shed some light on, like, if you can mention some of the projects on which government and the researchers are working presently towards preparing us for the future.
Yeah, so we know that most of the viruses have jumped from animals to humans.
Okay.
So government is now planning a big research mission mode wherein researchers would go to remote areas and kind of capture, let's say, bats and other whatever mammals from where these viruses are, and birds from where these viruses are expected to be jumping to humans, and screen the presence of unknown pathogens in those animals. So you know that these are the possible future pathogens which could come. So this, I think, is a great initiative. And maybe at the same time, they might even look at the mosquitoes,
Yep.
and see what viruses are being carried out by mosquitoes. So it can give you advanced warning for dengue and chikungunya and Zika, for example. So I think this would be a big game changer. Plus, the vaccine technology have been beefed up. The production capacity of India for COVID vaccines is as good as US.
True.
It could be even more. Yeah. And the affordability is incredible. New technologies for the vaccine productions have been approved by the Drug Controller Government of India. So I think a lot more is happening. Clinical trials are happening in parallel. A lot of clinical trial sites are being developed. Decisions are being made very quickly. So whatever could be done, I think COVID recatalyzed the biology and the biotechnology and healthcare. And now there is a concept of one health. It's not an animal health and a human health. We are all connected. So I think this One Health initiative is very important, and trying to, even to take an example of dengue, even when the rainy season disappears, this awareness, because of global warming, the mosquitoes are there almost around the year. So one has to be very careful that it's not only in the rainy season, post rainy season also, just ensure that you do not have fresh open water within 200 meters of where you stay. So things are happening, and funding is being made available nationally, internationally. Collaborations have opened up between countries. So I think we are making good progress.
So, doctor, as you mentioned while giving answer to this question, is that a lot of such diseases comes from animals, and like now we are seeing, like, and we are observing in the society that a lot of people are like, they're rejecting to be non-vegetarian and going towards like having vegetarian in their culture. So what do you think, like even like if we stop eating animals, which is very much widely popular in our society, so will that help our society to like transform this transformation of diseases from animals?
Absolutely. It means there is no second opinion about it. And I see that many people in other countries are truly becoming vegan.
Yes, sir.
Means they don't even consume milk.
Yeah.
So they believe in coconut milk or almond milk, complete plant-based food.
Yes, sir.
And that was our culture too.
Okay.
So, and this concept of protein and this and that, I think is all nonsense. There is enough protein in plants. You see the elephant, you see the horses.
True.
Horses have the highest power. Yeah. And what do they eat? Grass. Plants, they don't eat other animals. So this awareness that, and even if somebody have to eat, according to Sadhguru, he says that if you have to eat an animal, eat the animal which is so far away from your species. So don't eat another mammal because you are a mammal. Don't even eat the bird because birds are quite close to you. Go to the fishes, the water-based life, which is so far away. So the best thing would be to avoid these animal food, but if you have to, then avoid the animal food which is closer to you, like mammals and birds.
Perfect. So, doctor, I want to know for all those viewers who will watch this video and wants to understand the fact that why India is able to create like these vaccines and that too in such a affordable prices. Like because we all recognize this fact that India is a vaccine hub for the country, for the world. But how it is happening, like what we are doing something different from everyone in the world, which is giving us edge in the vaccine manufacturing industry, and we are able to make it so affordable for everyone.
Yes, so I think one is historically that we have been making all the vaccines which are required for an expanded program of immunizations since several decades. So we have a deep understanding and kind of a mindset for vaccines and vaccinations. Large volumes is our kind of a USP. So we produce vaccines in huge quantities, but I would imagine that sometimes I feel that the vaccines should not be that cheap.
Okay.
Why do I say that? Because vaccine companies, Indian vaccine companies probably send you 5 vaccines for $1. These are 5 vaccines made in good manufacturing practices. In last 10 years or 15 years, every price of everything has gone up. The electricity, the salaries, only thing which has gone down is the price of vaccines. So on one side, it's good that affordability is there, but there is a downside to it that the vaccine companies need extra support.
Yeah.
Because you don't have any funds left to do research, to take risks. And I think that is important. So although we are very, very competitive, which is a good thing, but I think this mindset have to change that the vaccine have to be so cheap. When it comes to buying alcohol, everybody goes and buys their alcohol, but everybody wants vaccine to be free. They even go buy tablets, medicines, but vaccine has to be free. I think those things have to change.
True. So, doctor, I want to know, because we all know, your contribution towards the disease of dengue, okay, by creating Dengue Kit 1. But I want to know, what are the new projects, currently, which you are working on with the International Center for Genetics, Engineering and Biotechnology, and which, has a potential to revolutionize this biotechnology and the vaccine, industry in the future?
Yes. So, as I said that we have been initiated to work on dengue by our Kalamji.
Yes.
And once you diagnose a dengue, the next thing comes, okay, you have dengue, now what do I do? Is there a treatment for dengue? So fortunately, with support from Government of India, we started to look at the Ayurveda-based bioassay guided strategy to look for anti-dengue botanicals, which means the compounds from the plants which could kill the dengue virus or which could treat the dengue fever. Fortunately, we were able to find such plant extracts and such molecules from the plants. This work has gone to now phase 2 clinical trials, and this is being done in collaboration with Sun Pharma in our country. This will be a game changer because if you have a drug, you can treat, not only diagnose, but treat. Right now, there is no drug to treat dengue. But we went a step further, that could we vaccinate kids or the population against dengue. So we have designed a dengue vaccine, which we believe is a game changer. This is also being done in collaboration with Sun Pharma. Dengue vaccine is being supported by WHO and by other agencies for maybe for 30 years, but there is no safe dengue vaccine. What we believe that we have made a vaccine candidate which is safe, affordable, deployable in all age groups, in dengue endemic, dengue non-endemic areas, and this is a recombinant protein which is safe and can be made in East. We have a global patent on this, and that work is also being supported by the government of India under their mission program against dengue. So things are happening. We stay focused on dengue because dengue is our problem. India remains the epicenter of dengue, and we need to find our own solutions.
So I want you to shed some light on the research and development work, because I believe that that is the essence of any creation or any innovation in the system. So what do you think, how important is research and development work?
Yeah, so research and development is the backbone and the brain behind everything.
True.
And fortunately, India has a tradition of good education system.
Yes.
We are fortunate. Whatever I said, whatever we could do was because of one of the best students we get from all over India. They come to our lab and they are very dedicated, motivated, and they value their contribution. As I said, that we keep asking each other, so what next, to keep you on the toes, so you know that is it relevant what you're doing, can you make something out of it, can you give back to the society. So I think R&D is now being supported, more money is being put into R&D, and not only in our countries, but even in other countries. Yesterday we had a team from Colombia who were saying that they used to have a big vaccine group 20 years back, but then, the groups were dissolved, but now the COVID had come, so the groups are being reassembled. So, quickly the way Indian scientists have responded in a very collaborative manner is amazing. So, and the support which comes from the government is now also supporting the industry. So there are special programs where, because sometimes the industry is not willing to take risks, the government comes to support those risks. So anything which is considered highly risky, the government is there to kind of offset that risk. So this government private public partnership, for example, from ICGEB, we are working supported by the government, Sun Pharma. So there is a private funding available. They are the one who are driving these things, and we are at the R&D front. They are at the translational front. So all these interactions are being encouraged. So you have a lot of translational research centers which have been set up by Government of India. There is a Translational Health Sciences and Technology Institute in Faridabad, which is about 10-15 kilometers from where I am right now in Delhi. And they also have the same mandate, that science for development. And I think those are very important core points for moving the country forward, to make it independent and to have the concept of one health for everybody. And I think we are on the right track.
So do you think COVID was a blessing in disguise for biotechnology?
Yes, I would say so, because there have been a lot of technology, for example, nucleic acid based technology for production of vaccines, which were not approved for a long time. There was adenovirus based vaccine technologies which were not approved. They were being worked for malaria, but there were a lot of questions. But COVID put so much pressure on the society and on the regulators that they started to take emergency authorization approvals to see what happens. So I think it really catalyzed the various technologies, and it kind of taught lesson to everybody that the vaccine development, which normally take 10 to 20 years, can be done in 1 to 2 years. But at the same time, we should not underestimate that even Moderna and Pfizer, which made it look like that it was a 1-year job, the messenger RNA technology on which they were working, they have been working on that technology for 15, 20 years. And it so happened that at the right time, they were able to deploy that. So even research is a continuous process. As I said, just like Army, Air Force, Navy, you need a bioforce continuously kind of ensuring the health of the people. They have to be supported. So that kind of funding is necessary for the bioforce.
Okay. So, doctor, in one of your previous answer, you mentioned the fact that students who are working under you played a very vital role in all of your research work. So, as we are here to discuss the subject of Dengue Kit 1, which you created, would you like to mention some of your students' role in that process of creating that very revolutionary kit?
Yes, so I have had close to 30 PhD students. And I would say that some of them I can name who were involved in Dengue Day 1. Gaurav was one of an asset for our lab at that time. He was able to kind of do everything what was required in the lab and work against the time with the company. Purnima was another student who was working with us at that time. Deepti was there. Gaurav has continued his diagnostic endeavors at Translational Health Sciences and Technology Institute, which I mentioned. He's an associate professor there. He made great contribution towards COVID diagnostic kits. He's also, we work together. We are trying to develop a diagnostic test which is finger prick based, which can detect the presence of HIV, HCV, or HBV, any of these 3 viruses in emergency medical settings, for example, in blood banks. Right now, what happens is when you go to donate a blood, first thing they do is they take 300 ml blood from you. And then they do post-screening for the presence of HIV, HCV, or HBV infections. Okay. And if something is positive, you throw the blood. What we are trying to do a game change is that can we do pre-screening, that before we take your blood, can we screen you from a finger prick, and in maybe less than half an hour, know your status, that are you a suitable donor? If yes, then we collect your blood. If not, then we don't collect your blood. Or for example, in emergencies, surgeries, where doctors don't know what the situation of the patient is about these infections, or in road accidents. So there, these kind of a quick, rapid test, multiplex test, which is now the moving frontier, decentralized tests, where you could imagine that even in an ambulance, these tests are lying there, and at site of an accident or a patient while being taken for delivery or whatever, you are for surgery, the status of HIV, HCV, and HBV. So the doctors who are going to do the surgery are kind of informed. They take the required precautions. So I think those things are happening. We have had several of my students, for example, Upasana had worked on dengue drug and dengue vaccine. Vishwa, who has stayed with us for over 10 years, he designed this vaccine candidate, which they're talking about. And fortunately, many of these students did not go to other countries after finishing their PhDs. Okay. Now, the government of India provides them these postdoctoral fellowships and other possibilities. And as I said, that many of these students which I named found jobs either in the academic institute like THSTI, or Rahul Shukla was another one of my bright student who is a faculty at CDRI Lucknow. And Vishwa, Upasana, Ravi, Richa, all these students have now joined Sun Pharma because the projects are moving towards the translation with the company, and they also need this experienced students so that you get a jump start, and there they set up these technologies.
Okay. So, sir, like last year, what I read in like different publication is that government recognized your effort towards the contribution of in biotechnology, and you got the 4th highest civilian honor, that is Padma Shri award. So first of all, sir, congratulations to you, sir, from personally from my side and on the behalf of my team. So, and sir, I want to know like how was that experience, because not many people get such recognition. So how was it experience when you got to know about that, and how it felt when you like personally when you received that award, that souvenir? So how it felt, sir?
So it was a complete surprise because I never applied for it. You see, most of the awards you apply,
Okay.
somebody has to write one page for you. I don't know who wrote that one pager for me. I'm trying to figure that out. That time I think this was 25th of January, because on 26th January they announced these results. I
Yes.
was in New York. It was night, middle of the night there, 3 o'clock in the morning. My phone started to ring. I didn't pick up because this was an unknown number. It rang again. I didn't pick up. It rang the third time. I said, wow, maybe I should pick it up. And I was half sleepy. Then I get someone from this side, Government of India, telling me, congratulating me for this award. And then he said that before we announce to the TV, we wanted, instead of you learning from the television, we wanted you to learn from us. So I thanked him, and then I went to sleep, and I got up at 7 in the morning, and I was thinking, was it a dream? Because I had no idea, no clues. But thanks to this, our new Government of India, which actually goes and looks for people who are contributing silently. So I think a lot of changes have happened in New India, and I give this credit to this team of Government of India who actually goes and look for these people. And you've seen in last couple of years a lot of unknown faces.
Yes, sir.
Who have really made contributions. So this, I feel very honored and humbled with this recognition. And this is a great motivation to my team and several other people, several other researchers who would want to contribute towards public health through their lab efforts. So I truly want to thank everybody who was involved in this decision making. I had no idea this was such a wonderful surprise.
Nice, sir. So, sir, as you mentioned here, that leadership is very important. The way this government is picking up like unknown personalities for these for such honors is really appreciable. So, what I want to like ask you, I want your wisdom too, is that, sir, like as you mentioned earlier, that it was Dr. Kalam who wrote letter to your institute to create
Yes.
something which could identify the dengue disease in the first day only. And now this leadership is picking up unknown people for such honors. So what do you think like the significance of leadership in the country, which could help to revolutionize the different systems and help people at the very micro level?
Absolutely. So a true leader, I also wanted to mention the name of Professor M.K. Pan, who was Secretary, Department of Biotechnology. Unfortunately, he is no more with us. He was a great supporter. You know, he was a true leader because he cared about other people's happiness than he cared about himself. So I think that change is important, that a true leader always thinks from other people's point of view and is always trying to find a solution and not become a problem. So we have a joke in our, if you are not the solution, maybe you are the problem. So I think those kind of mindsets, and the country has a great leader now. And I think we have seen that how we have done so well during this COVID epidemic. Nobody blamed anybody, but they just all got to work, from NITI Aayog to Department of Biotechnology to hospitals to all the other health workers. I really salute them for kind of keeping the country safe. So I think we are on the right track now.
So, sir, in this session, we have touched upon the past and the present. Now, sir, I want to, before I conclude this session, I want to talk about the future of the biotechnology, and also for all those aspirants, all those students who are right now studying the biotechnology.
So I think one thing which one has to be very clear, because there is a difference between biology and biotechnology. Many times we are doing biology, but we call it biotechnology. I think that difference should be there. It's the business of biology is biotechnology. And concepts like International Center for Genetic Engineering and Biotechnology, where I have been fortunate to be working with this organization for past 30 years. This has presence in about 65 to 70 countries. Most of them are not, most of the Europe and US is not a member of this, but most of the Latin America and African countries and Asian countries are members. So these kind of organizations which focus on biotechnology and use of biotechnology for developing nation, use of biotechnology, providing solutions to your health, agriculture, environment, biofuel. So these kinds of programs are being run at ICGEB in various components of ICGEB. So I think this was a great concept which started about 30 years back, and we understand this lot of collaborations is needed. This organization provides a lot of fellowships to students, training programs to students, exchange between the different labs. So an umbrella like this is a wonderful opportunity for students who want to do some contribution in biotechnology, and with taking from lab to the market, not just staying with the lab. So a lot of opportunities are available. And as I said that in past, most of the students after being trained would go to other countries, mostly US and Europe. Now, as I said, in last 10 years, nobody has gone. All of my students who were trained at ICGEB are within this country. So you're using that talent for the country, not for the other countries. So companies have come up. As I said, that a lot of vaccine companies and a lot of my students who now work with Sun Pharma. So a lot more opportunities are available, and students are happy working here within their own country and having all those opportunities which were missing maybe 20 years back. So country is changing. We are able to keep the bright kids within the country. So and it's the skilled manpower which makes the difference. Also, because money, you can always get it nationally, internationally. You can be competitive. Funds can be provided, including ICGEB can provide funds to carry out this work. So I don't think money is a problem. It is the skilled manpower which is very necessary for the success of biotechnology. So means in that sense, we can say
that in the new India, we are seeing reduction in brain drain.
Absolutely, absolutely.
No, sir. And also one thing I want to add here, that indigenization is not just happening in defense industry, but also at a very micro level, it's happening in all the sectors.
You are absolutely right.
No, sir. Okay. So, doctor, at the end, like as we started with the subject of dengue in Uttar Pradesh, the rising cases in Uttar Pradesh. So, because it's a very sensitive matter right now, and it's also prevailing right now. So, I just at the end, I want your message for all those who are suffering right now, or those who are like having their family members suffering with the intense level of dengue. So, what would be your message, sir, to all of them?
So two messages. One, just make sure you have fever, don't stay at home. Go yourself to the hospital, get it tested. Because if it is tested early, doctors can manage it. The mortality from dengue in several countries, for example, Sri Lanka, is 0.01%. In our countries, it will be 2%. But most of the time, when the patient reaches to the hospital, too late for doctor to handle. That is one thing. So as long as then you have fever, don't stay at home, go to the hospital. This is one. And second, just ensure that there is no kind of a clean, open water within 200 meters or 100 meters of your home or workplace. These are the two things, and you shouldn't wait that, oh, it's only during the rainy season. Most of us have tanks, on the roof or on the ground, because water doesn't come 24 hours. Tanks would be overflowing. So just have to make sure that around the year, we are just aware of small little things, and we do our contribution to avoid dengue, because dengue is a big public health burden. It drains all your progress. So it's a minor thing to ask from our citizens. And I think they, at many places, for example, resident welfare associations are taking care of this. But every individual, I have to make sure, for example, at ICGEB, you will not find this dengue mosquitoes. You will not find, because this is how it is kept. You will not find dengue mosquito around my home, because we are aware of it.
Yes.
So I think, and fortunately, Indians respond very well. You just have to tell them, it will happen.
True. I hope, sir, with this podcast, your message reaches to the maximum people, and also they implement the ideas which you have shared here. I hope that they implement that in their daily life, and also they convey it as a mouth-to-mouth advertisement. They convey it to others also. So,
I have full faith in them. They will do it. It's just you have to keep reminding them.
Yes, sir. So thank you very much, doctor, for like taking your time, taking your very precious time for us. And it was definitely one of the most informative and one of the most lovely conversation I had during the process of like creating this podcast. And I truly believe this, sir.
Thank you. I truly enjoyed interacting with you.
Thank you very much, sir.